I now recognize Ms. Lesko from Arizona.
Thank you, Mr. Chairman, and thank you all for being here today. My questions are going to be to the Ambassador. Ambassador, on January 14th, 2020, the WHO tweeted that, quote, preliminary investigations conducted by Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus. A National Review article states that the Chinese Communist Party jailed any doctor that disseminated any information about COVID-19 that was not first cleared through their state-run media. A Wall Street Journal article states that the U.S. intelligence sources since discovered that the CCP covered up and lied about the extent of the outbreak. According to the CIA, on January 21st, 2020, China threatened to cease participation in all international COVID-19 efforts if the WHO declared a public health emergency of international concern. Well, guess what? WHO delayed declaring COVID-19 a public health emergency of international concern. By the time the WHO declared COVID-19 a public health emergency of international concern on January 30th of 2020, the disease infected almost 10,000 and killed 1,019 different countries. Despite declaring COVID-19 a public health emergency of international concern and extensive evidence of transmission through travel, the WHO insisted other countries not restrict travel or trade to China. In fact, the WHO never recommended restricting travel. The WHO routinely praised the Chinese Communist Party's efforts to combat the spread of COVID-19, despite multiple reports that the CCP engaged in a massive disinformation campaign. According to the U.S. intelligence community report, the CCP severely underreported both its total number of cases and deaths caused by COVID-19. My question, Ambassador, do you believe the WHO relied too much on false information from the Chinese Communist Party?
Thank you, Congresswoman, for that very important question. And it is very clear that, and I agree with you entirely, that CCP did not act in this crisis in a way that was responsible in terms of fighting a threat that had emerged. It wasn't accountable, it wasn't transparent, and it didn't act in a timely fashion. That is very, very clear. I think WHO has since become more forceful. There are several pronouncements that WHO's leadership had made over the course of, as the pandemic evolved, and they've become more critical. But has that enabled and provided the right access to information? I don't think so. We need to continue to press hard on CCP to have the right information. I think the reforms that are underway going on at WHO and the pandemic accord and the revisions of the IHR are all instruments that I believe strongly so that working with others is the best way for us to be at the table, build a coalition of people that are like-minded so that they can put the right pressure on any country that behaves in that fashion, including the PRC.
Well, and so I think you said something about it, but what other reforms are needed before the U.S. invests more money in the WHO? Because ultimately, isn't that the United States leverage, is not to invest money until they do the reforms?
I think the reforms that WHO is currently leading, and we are at the table pushing that, is in the areas of accountability, country-level impact. That is what happens in country, because we know that a threat anywhere in the world is immediately a threat here in the United States. Governance of WHO, the human resources, financial resources. So there's a whole set of categories of reforms that we've put on the table for WHO, and we are pressing WHO to carry that on. And as I said earlier, of the 96 action items, about 67 have been acted on. About 29 of them will be acted on by end of 2025, and we will keep an eye on that and continue to press them to change and reform.
Well, thank you, and please continue to press them to reform because it's a lot of money that we're investing, and I don't want them controlled by the Chinese Communist Party. And so with that, I yield back.